let's talk about the types of pain and their pathology under interviewing. So we have here a table where you differentiate the types of pain and their patterns. So for soreness, there is dull ache that usually occurs in the forelimbs or trunk. The patterns would be either deficiency condition or dampness. If the pain has a feeling of heaviness, or this is what they call heavy pain, there will be dull ache accompanied by a sensation of heaviness. This usually occurs in the limbs, head, or the whole body. Patterns would be dampness or phlegm. Distending pain or bloating, there will be subjective bloating sensation. Bloating also may be felt on palpation when the area feels distended like a balloon, and this is seen on observation. Pattern is chi stagnation. Pain with feelings of fullness. The patient feels very full, as if after a heavy meal, perhaps also with a slight nausea, and the area feels hard rather than distended on palpation. Fullness cannot be seen on observation. Pattern is dampness. Ache with feeling of emptiness. This often occurs in the head. Pattern, chi and blood deficiency or kidney deficiency. Pain with feeling of cold. Sharp stabbing or spastic pain that is clearly accompanied by a pronounced feeling of cold or even shivering, and that is alleviated by the application of heat. Pattern, full or empty cold, usually in the abdomen or limbs. Burning pain, there is pain with a burning sensation. Pattern, full or empty heat, usually in the epigastrium or in the limbs. Colicky pain, this is sharp pain of a colicky, cramping nature. Pattern, cold in the intestines, blood stasis, usually in the epigastrium or more usually the lower abdomen. Spastic pain, this is sharp pain accompanied by spasm, which is contraction or a sensation of spasm. Pattern, liver blood deficiency in conjunction with liver qi stagnation or liver yang rising, usually in the limbs or head, and is related to the sinews and therefore the liver, either of full nature or a combination of deficiency of liver blood and fullness, stagnation of qi. Dull ache is very mild pain. Pattern, deficiency, usually chronic, long duration ache. Pain with distressing feeling. This is pain accompanied by a restless, undefined, anxious feeling and perhaps palpitations, usually in the epigastrium or chest. Pattern, retention of phlegm in the epigastrium, affecting the heart or rebellious qi in the penetrating vessel. Pain with sensation of stuffiness. There is pain with a mild feeling of fullness while the abdomen feels soft on palpation, usually in epigastrium or chest. Pattern, deficiency of the spleen and fullness, heat or phlegm. Pushing pain. Sharp pain accompanied by a feeling as if something was pushing the area, usually in the hypochondrium or epigastrium. This is severe qi stagnation. Pulling pain. There is sharp pain accompanied by a sensation as if the skin were being pulled, usually on the head. This is liver wind. Cutting pain. Very sharp pain that feels like a knife, usually in the lower abdomen. Blood stasis, definitely full in nature. Throbbing pain. Severe pain feels as if there was a throbbing or pulsation, usually on the head, very common in headaches from liver yang rising. Pattern, liver yang rising. Boring pain feels like the stabbing of the tip of a knife blade, a nail, or a screw. It is fixed in location, usually in the lower abdomen, epigastrium, hypochondrium, chest, or head. Pattern, blood stasis, full in nature. Lurking pain, pain that is not severe, not acute, relatively easy to endure, but chronic and persistent. In Chinese, called yin tong, which means latent, hidden, or lurking pain, usually improves with the application of heat, generally in the abdomen or lower back. Pattern, qi and blood deficiency or empty cold in the interior, leading to malnourishment of fire channels. Now, let us differentiate the pain resulting from deficiency, resulting from fullness, cold, and heat. If the pain is due to deficiency, applying pressure would alleviate it. If it's due to fullness, Pressure would aggravate it. Food will alleviate the pain resulting from deficiency, and the pain is aggravated by food if this is due to fullness. If the pain is due to cold, food will alleviate, hot food will cause an alleviation, and cold food will aggravate it. If the pain is due to heat, cold food will alleviate the pain, and hot food will aggravate it. So the type of pain, if it is due to deficiency, it is dull or lingering pain. If due to fullness, it is sharp. If cold, it's cramping, spastic. Heat, burning. Temperature. The pain due to cold, if you apply heat, the pain will be alleviated. And pain due to heat, applying cold would alleviate pain. Bowel movement will aggravate the pain resulting from deficiency, while bowel movement will alleviate the pain resulting from fullness. And if the pain results from cold, the bowel movement would aggravate it. Pain resulting from heat, bowel movement will alleviate it. Posture. The patient would feel better lying down if the pain is due to deficiency. If the pain is due to fullness, the pain is better sitting up. Pain resulting from deficiency has a slow, gradual onset, while pain resulting from fullness has a sudden onset. Vomiting will aggravate the pain caused by deficiency and alleviate the pain caused by fullness and cold. And vomiting will alleviate the pain caused by heat. And finally, the pain will be alleviated if the pain is due to deficiency. The patient feels better with rest. And if the pain is due to fullness, the patient would feel better with exercise. If the pain is due to cold, it's better with exercise. And if the pain is due to heat, the pain is rest or the feeling would be worse when the patient would exercise. Thank you for your attention.